Hi, I'm Sarah Bryce. I'm a registered nurse, and today I'm going to introduce you to the Picosure Focus for skin revitalization. We'll review the Picosure handpieces, graphic user interface, suggested treatment settings, and then walk through a step-by-step Picosure Focus treatment for facial revitalization. Let's get started. Please review the Picosure Clinical Reference Guide for a complete list of indications and contraindications for Picosure treatments. As with any medical procedure, it's important to review patients' age, skin type, medical history, family history, current medications, the reason for seeking treatment, and understanding patient expectations. Patient documentation is important to the success of any laser treatment. Sample forms as well as pre- and post-treatment guidelines are provided in the Clinical Reference Guide. It's important to take before and after photographs of each patient to document the progress and assist in development of a clinical treatment plan. To start, we're going to pick our handpiece. There are 3 fixed handpieces that come with your Picosure. There's a 6mm, 8mm, and 10mm. Today we're going to be using the 6mm handpiece, and this is the one that you're going to be using most often. To insert your handpiece, you're going to line up your red dots and twist to the right, and then you're going to put on your focus tip, and you'll hear a snap, and then you will place your distance gauge on the end. And you're ready to go. Before beginning any treatment, we want to make sure that we clean the face with alcohol, soap, and water just to make sure we get off all the lotions and oils or makeups that might be on there before starting. And then we also want to make sure that the patient and anyone in the room is wearing the protective eyewear for the 755 nanometer wavelength. Today our patient that we're treating is a skin type 2, so we're going to be working with a 6mm handpiece with the focus tip attached to the end. We're also going to be working at 10 Hertz, of which you want to make sure that you change before putting the laser into the ready mode. Each focus tip is good for 40,000 pulses, and on average we're going to be putting in somewhere between 4,000 and 6,000 pulses into a face. When your focus handpiece is attached, you're going to see on the right-hand side of the screen the number of pulses remaining for that tip. On the left side of the screen, you're going to have your pulse counter, of which you can keep track with the number of pulses you're putting in as you're doing the treatments. For the first couple of focus treatments, it's helpful to divide the face into 4 different quadrants. So you have this side of the face being one quadrant, the forehead being your second quadrant, the right cheek being the third quadrant, and around the mouth, nose, and chin area would be the 4th quadrant. For increased comfort during the procedure, some patients do prefer to have the chiller to hold during the actual treatment itself. The handpiece should be held perpendicular to the skin, with the tip slightly touching the entire time of treatment. So for the treatment, we're going to be doing a painting or feathering technique with about a 25% overlap in multiple different directions. Again, you want to try and keep your handpiece as perpendicular as possible. You also want to pay attention to the sound that you're hearing as you're hearing the snapping. If your handpiece is slightly off the skin or if it's not perpendicular, you will hear a different snapping that will indicate you need to get realigned. And just pay attention to the speed of my hand. This is a very fast treatment. For this patient today, we're going to be putting in around 5,000 pulses. So in between treatments, you just want to make sure that you're looking at your pulse count to see how many pulses you put into each quadrant so you don't over or under treat. In order to avoid the eyebrows and other bits of hair, you can use a tongue depressor. 1, 2, 3. While holding the handpiece, especially while you're on areas that are somewhat curved, you have a tendency to sort of want to sling your wrists back and forth, but you want to make sure that you stay in that constant gliding motion where the tip is touching the skin and you stay perpendicular with the area you're treating. While doing this treatment, you definitely will want to focus more pulses into your areas of concern. While doing this treatment, you're looking for a slightly grayish frosting and a mild to moderate erythema. So as you can see, the frosting that we saw has started to dissipate and is now no longer present. The mild to moderate erythema that we're seeing will last for about an hour, anywhere between 1 and 4 hours. And the patient can put on moisturizer, SPF, or makeup and continue on with all their normal activities of the day. And that's why patients are loving this treatment.